We are the Association of Nigerian Private Medical Practitioners, ANPMP.
My name is Ambassador Dr. Ike Odo, National President of the Association of Nigerian Private Medical Practitioners, ANPMP. This is a recorded version of the appeal that the ANPMP is making to the National Electricity Regulatory Commission, NEC, through our hired consultant, who is already engaging them with facts and figures on the suffocating and stifling, demoralizing, overbearing cost of power on private hospitals and clinics and healthcare professionals across the country. Please listen.
Yes, the overheads of running hospital is enormous, especially in Nigeria, and it's obvious from all available records that cost of power after salary is the highest on the list. And it surprises us that as doctors, social welfare workers, we pay the same tariff on power as banks, hotels, oil companies, and other commercial ventures. There is nowhere in the world this happens. From India to Dubai to UAE to Europe to America. In healthcare financing, there are so many things that account for healthcare financing. Whatever brings down the cost of providing medical service is considered a healthcare finance instrument. Reduced subsidized cost of power is helping to fund healthcare. It helps bring the cost of a service down and therefore brings down the cost of the bill available to the patient. If the hospital is giving concessional banking interest rate, it's healthcare financing. If hospitals are giving import duty waivers for their drugs, consumables, and equipment, it is healthcare financing because it's helping to reduce cost of production or cost of service. If we pay less for power, we are supporting to promote affordable and accessible and quality healthcare. It's healthcare financing. Now, people may want to wonder, why are Nigerians, Nigerian doctors, Nigerian nurses, radiologists, radiographers, they're all leaving the country in droves. And very soon, it will be very difficult to run our healthcare institution because there will be no professionals at home. Why are they leaving? Many are leaving because their salaries can't take them anywhere, both in public and private. Insecurity is there to contend with. Very poor working environment is there to contend with. There are doctors who ordinarily will wish to open these facilities, hospitals, and run. But how can they run it when they don't have the capital, when they cannot afford the issue of power? Today, for example, for you to own a hospital or clinic and have it accredited by the State Ministry of Health and other accrediting agencies, including the Federal Ministry and the agencies of government, companies, health maintenance organizations, even corporate organizations when it comes to retainerships, like Shell, Agid, Chevron, and other IOCs. You must show evidence of having the direct supply from the national grid, 1. 2, you must show evidence of at least 2 generators. 2, not 1, as backup. How many Nigerians can afford it in these difficult times? So when you see that as a startup, you can't go to the bank, you can't pay their interest, you cannot afford power to 24 hours a day because, 1, the cost of the tariff you can't bear. Generator you cannot buy. You run out of the country. Those of us who have made up our mind to stay back, sometimes we are posting losses at the end of the month because of power. And so that's why the appeal is being made. It's a national assignment, a national burden, a national responsibility, a national task that we think we should all respond to. It calls for understanding, and it calls for the long vision of the overall impact on the Nigerian system, the healthcare system, the economy. Because if we had power, power alone will encourage more hospitals to spring up. More than half of Nigerians living the country will stay back. People will now be happy to go to the villages and open up facilities. Nigerians will stop dying the way they are dying. It's a shame that the life expectancy of the average Nigerian is 53 years. Everything we do to support our industry, to support our healthcare system, is contributing to revamping the industry, to rejuvenating the industry, to transforming the industry. Right now, as we speak, statistics are clear that Nigeria as a country spends over 600 billion naira every year in paying for overseas treatment in the name of medical tourism out of Nigeria. And yet, if we take measures to address our own challenges, our difficulties, our peculiar terrain, and the ecosystem of marrying in synergy the health system, the economy, banking, power, utilities, and all that, and they are attractive, we will achieve what India has achieved and surpass it. Now the question is, what is the secret of India? Before the 80s and early 90s, India was worse than Nigeria in their economy, in their institutions, professional groups, including medical. And they were all over Nigeria begging for jobs. And they took salaries below those of Nigerians. And they were happy. Today, I have an Indian doctor, and all over the country, Indians proudly tell you they are expatriates. And you pay them accordingly. What happened? The Indian government, early in the 90s, took referendum, sent ambassadors, emissaries across the world, from Europe to Canada, to Australia, to UAE, to sensitize Indians, to mobilize them, to say we need to build our own health system. Come, let us reason together. And the Indian government interfaced with the health system, and they agreed on points of development. What must we do to support you to develop a robust, qualitative, and competitive healthcare system and become relevant in that regard? And the doctor gave them all that was necessary, including financing where interest rates are just one single digit. To the extent that as I speak to you, I had an interface 3 months ago with the team from Narayana Healthcare City in India, where they see over 10,000 patients in a day. It's a massive expanse of a community of hospitals. Groups of hospitals agreed to buy an entire layout. You are cardiology, you establish cardiology. I am nephrology, I establish nephrology. Into estates, plots. Once you drive into that ecosystem, whatever industry, surgery is there, neuro is there, pediatrics is there, anesthesia is there, everything medical. Guess what? I told my guests about my hospital. We're trying to showcase my pedigree, the journey I have traveled, the pains, the burden I had gone through, for example. So I told them how much I bought the land on which I built. And they said to me, "You bought the land?" I said, "Yes." He said, "Why?" The land on which Narayana Healthcare City was standing, nothing was paid. As part of government support, that land was given free. Things don't work that way here. The money they use to develop the facilities, single-digit loan, 6 to 7 years moratorium, 25 years tenure or more. It encouraged Indians to start to bring back to the country. To the point now, as we speak, they have so developed their healthcare industry that Americans, Canadians, Australians are going to India. Yes. India will give you the same quality at less than half the price in America. So this is the case we want to make to our country. We have a large population of doctors supporting this country. Without us, Nigerians will be dying more than they are doing today. Now it is on strike. Who is doing the job? Private doctors. What is government doing for us? Bank rates, they are not addressing. Import duties, they are not addressing. Security, they are not addressing. Power, they are not addressing. We are being submerged.
I therefore, on behalf of the Association of Nigerian Private Medical Practitioners and the entire Nigerian population, the suffering and struggling Nigerians, appeal to the leadership and management of the National Electricity Regulatory Commission to rise to the occasion, rise to the moment, show sensitivity to the plight, the yearnings, the sufferings, and the lamentations of the Nigerian people. The bowing and cowed healthcare system to take measures to respond to the records of history and to the expectations of posterity. That by just this one stroke, you will have made history by bringing down the burden and taking away the scourge of the highest index of overhead that is bringing down and breaking the backs of healthcare providers, making MDs of hospitals to shut down, sell their facilities, and jump into the plane and get abroad, just to have the peace of mind that they can afford to at least live. And those of us who have determined to sit back to save this country, to support this country, to help this country, to show patriotism, to put our lives on the line, should be assisted, should be supported, should be given the lifeline as nationals and patriotic professionals. It is doable. It has been done across West Africa, beyond Europe and America. It is not rocket science. It's about humanism. It's about humanity. It's about consideration. It's about leadership. It's about showing moral and social commitment to a national ideology and a national burden, a national demand. Nothing solves a problem except the solution. And we cannot win a battle we have not presented ourselves to. We have to engage the problem to provide necessary solution. We appeal to you on behalf of Nigerians to please show mercy. Take this measure to reduce and give Nigerian healthcare providers, Nigerian private doctors, this waiver, a specially subsidized tariff, making healthcare better affordable while we await the National Assembly to give vent, to give assent, to give authority to the new mandate we're expecting, to make health insurance compulsory for Nigerians in such a way that every Nigerian out there carries a health insurance card, so that medical emergencies will cease to be economic, financial emergencies to Nigerians. With NEC collaborating and the central bank coming in to provide grants, single-digit loans, and establishing health banks, what else do we need to support brilliant, hardworking, committed, intelligent, sacrificial, courageous, visionary Nigerian doctors who are all over the world building healthcare systems to top first-class levels, when back home in their own country we are slipping and getting deeper into the valley of frustration and negligence because of unavoidable frustrations. I thank you while believing that you have heard us, and God will touch your heart to do the needful. History will record it for you. Posterity will not forget. And Nigerians will forever be grateful. And the Nigerian doctors whom I represent will celebrate you. Thank you, and God bless you.
The Association of Nigerian Private Medical Practitioners, ANPMP
Forever.
ANPMP.
We are greater together.
My name is Ambassador Dr. Ike Odo, National President of the Association of Nigerian Private Medical Practitioners, ANPMP.
We are the Association of Nigerian Private Medical Practitioners, ANPMP
Forever.
ANPMP.
We are greater together.